Hello everyone, welcome to the module on the cardiovascular system. In this module, we will talk about regulation of blood pressure. Okay, so let me just revise the already explained facts of the renal system that we have spoken about the ANP and BNP, that is atrial natriuretic factor or peptide, and BNP, that is B type natriuretic peptide. So what does these two hormones do? Now, ANP is released by the atrial myocytes in response to the increased blood volume and increased atrial pressure. So when the pressure in the atria and the blood volume in the body is high, ANP is released by the atrial myocytes. Now this acts via the cyclic GMP pathway and it causes majorly two effects, that is vasodilatation and decrease in the sodium reabsorption, that means increase sodium excretion. Now since sodium is lost, with sodium even water accompanies and hence there is decrease in the blood volume. So it majorly causes vasodilatation and decrease in the sodium reabsorption of the renal connecting tubule. Is this clear? Now, ANP dilates the afferent renal arterioles and constricts the efferent renal arterioles. Now, this leads to promotion of diuresis and this contributes to aldosterone escape mechanism. Is it clear? Now, talking about BNP, it has similar actions like ANP. Now, it is released by ventricular myocytes. This is released by the atria, this is released by the ventricle when there is increase in the tension. Now, it has very much similar effects as of ANP with a longer half-life. That means even small amount of BNP leads to excessive amount of release of sodium ions and it lasts for a longer period of time. Now, BNP blood test is used for diagnosis of heart failure. Okay, and it is a very good negative predictive value. That means if it is negative, then it is a very good predictive value. Now, it is available in recombinant form, that is nesiritide, for the treatment of heart failure. Now, with ANP and BNP, there is also renin-angiotensin-aldosterone system. Okay, I have already discussed ANP and BNP in the renal system and even a separate video on the renin-angiotensin-aldosterone system. So please check that out. Now let me just directly jump into baroreceptor mechanisms. Okay, so the blood pressure is controlled by baroreceptors and chemoreceptors. Now there are majorly two types of receptors. The first one is the aortic arch receptors and the second one is the carotid sinus receptors. Now, as the name suggests, the aortic arch receptors are present on the arch of aorta and the carotid sinus receptors are present on the junction between the separation of carotid artery. Can you see this? So, this is the place of carotid sinus baroreceptor and this is the place of aortic baroreceptor. Is it clear? Now, aortic arch transmits via the vagus nerve to the solitary nucleus of the medulla oblongata. That means all the senses is transmitted by cranial nerve 10. A cranial nerve 10 from here moves to the solitary nucleus of medulla and transmits the signal of blood pressure. Now, it responds to change in blood pressure, whereas the carotid sinus, that is the receptors present over here, transmit their signal via cranial nerve 9 through that is the glossopharyngeal nerve to the solitary nucleus in the medulla oblongata. Is this clear? So please remember that the aortic arch transmits via the vagus nerve and the carotid sinus transmits via the glossopharyngeal nerve. Is this clear? Now, let me just talk about the baroreceptor mechanism. So, how does these receptor function? When there is hypotension, that is decrease in the blood pressure, there is decrease in the atrial pressure, correct? Now, since there is a decrease in the atrial pressure, the blood exerting force on the atrial wall is less, which leads to decrease in the stretch. Now, if there is a decreased stretch, then the afferent baroreceptor firing is less. Afferent baroreceptor firing means the vagus nerve and the glossopharyngeal nerve firing is less. Now, due to decrease in the baroreceptor firing, there is an increased sympathetic firing from the efferent pathway. So, there is increase in the sympathetic firing and there is a decrease in the parasympathetic firing. Since the blood pressure is low, the sympathetic system increases and the parasympathetic system decreases. Am I clear? Now, due to this mechanism, that is increase in the sympathetic chain and decrease in the parasympathetic chain, there is vasoconstriction. Now, vasoconstriction leads to increase in the heart rate, contractility, and eventually leads to increase in the blood pressure. And hence, it is an important response during hemorrhage. Now, during hemorrhage, due to excessive loss of blood, there is hypotension, and hence, due to increase in the efferent sympathetic firing and decrease in the parasympathetic stimulation, there is restoration of the blood pressure. Am I clear? Now, let me talk about one more concept, that is carotid massage. Now, whenever a person wears a tight shirt or buttons the shirt tightly, there is a pressure exerted on the carotid baroreceptors. Now, due to increase in the pressure on the carotid sinus, there is increase in the stretch, correct? Now, when there is an increase in the stretch, the brain thinks that it is a high blood pressure situation because of increased afferent baroreceptor firing. Now, when the stretch is high, the firing will be high. Now, if the firing is high, then there is more signal sent to the medulla oblongata. Now, eventually, it will think that there is excessive blood pressure and hence there will be an increase in the AV node refractory period. Now, AV node refractory period increases resulting in decrease in the heart rate. That means it will take a longer period of time for AV node depolarization. So, the heart will beat slowly, resulting in decrease in the heart rate. So, is the carotid massage clear? Yes or no? Now, let us talk about component of Cushing reflex. That is, when there is a triad of hypertension, bradycardia and respiratory depression, that is, during increase in the intracranial pressure that constricts arterioles, there is cerebral ischemia. Okay, so there is a ischemia in the brain. Now, due to cerebral ischemia, there is increase in the PCO2 and decrease in the pH. Now, this is sensed by the central receptors and there is a central reflex sympathetic increase in the perfusion pressure. Now, there is an increase in the sympathetic system. Now, due to this increase in the sympathetic system, there is increase in the perfusion pressure, which leads to hypertension, and there is increase in the stretch. Now, this stretch leads to peripheral reflex baroreceptor induced bradycardia. That means due to increased stretch, there is bradycardia induced. Is it clear? Now, let us talk about the chemoreceptor mechanism. Okay, let us talk about the chemoreceptor mechanisms. So, there are two kinds of chemoreceptors. The first one is the peripheral chemoreceptors and the second one is the central chemoreceptors. Okay, the peripheral chemoreceptors are present on the carotid and the aortic arch, that is the carotid sinus and the aortic arch, and are stimulated by increase in the partial pressure of carbon dioxide, decrease in the pH of blood and decrease in the PO2. Please remember, it also responds to decrease in the PO2. Now, talking about the central receptors, which are stimulated only by pH and PCO2 of the brain's interstitial fluid. Okay, so these are sensed directly by the brain and which in turn influence atrial CO2 as H plus cannot cross the blood-brain barrier. Now, it is majorly regulated by the carbon dioxide concentration in the interstitial fluid of the brain. So these central receptors sense the carbon dioxide content. Okay, they do not directly respond to the CO2 levels, that is, they have no control over the CO2 response, and central chemoreceptors become less responsive with increase in the PCO2 chronically. When there is a chronic increase in the PCO2, that is in conditions of COPD, the chemoreceptors become less responsive, and hence there is an increased dependence on the peripheral chemoreceptors to detect the decrease in the oxygen content. So peripheral chemoreceptors are very important as they sense all the three, that is increase in the PCO2, decrease in the pH, and decrease in the PO2. Am I clear? Now let us talk about the last section, that is autoregulation of different organs. Okay, so how blood flow to an organ remains constant over a wide range of perfusion pressure. First of all, talking about the heart, there are local metabolites released like adenosine, nitric oxide, carbon dioxide, and decrease in the oxygen. So these are the major factors that determine the autoregulation of the blood pressure in the heart or the blood flow in the heart. Now talking about brain, it is majorly regulated by the local metabolites, that is CO2, as I've already discussed. The kidney maintains its blood flow by two mechanisms I've already discussed in the renal system, so please check that out, that is myogenic and tubuloglomerular feedback mechanism. Lungs, when there is hypoxic condition, that is decrease in the oxygen content, it vasoconstricts. The skeletal muscles also have their local metabolites, that is abbreviated as CHOG, that is CO2, H+, adenosine, lactate, and potassium concentration. Whereas at rest, they are majorly regulated by sympathetic tone. Okay, so during exercise, it is regulated by these 5 mechanisms, whereas at rest, it is regulated by sympathetic tone. And the skin is majorly regulated by the vasoconstriction, which is the most important mechanism for its temperature control. Is it clear? Now the pulmonary vasculature is unique, okay, and the alveolar hypoxia causes vasoconstriction so that the well ventilated areas are perfused. In other organs, hypoxia leads to vasodilatation. If there is a hypoxic condition, the lumen of the artery will increase, leading to increase in the blood flow, which will cause decrease in hypoxia. So other organs, there is vasodilation, but when there is alveolar hypoxia, there is vasoconstriction because only well ventilated areas are perfused. Is it clear? So this is all about regulation of blood pressure. Thank you for watching this video. If you enjoyed the video, please click on the like button and do subscribe to this channel. Let me know in the comment section below which topics do you want me to explain. Thank you.